Traumatic brain injury, known as TBI, can range from mild to moderate to severe. The myth about TBIs are that they are uncommon, which in fact they are often misdiagnosed and left untreated. The CDC reports annually that 1.5 million people suffer a TBI in the U.S., 50,000 people die from a TBI, and 85,000 people suffer long-term disabilities. I have a key interest in physical and emotional trauma on K-12 age students and how that directly relates to how they learn and interact within a structured school setting. I currently have 2 students of interest, one with a documented brain injury and the other with a brain disorder. Student C suffered a moderate traumatic brain injury around the age of 9. She was involved in a vehicular accident where her right eye was removed from the socket and required surgery to repair it. The long-term effects of her traumatic brain injury are still unfolding and presenting current issues 3 years later. Student J has a brain disorder known as agenesis of corpus callosum. This is where the part that connects the cerebral hemisphere is completely absent, which can lead people to have mild to severe effects. Student J seems to have mild effects such as reading problems and social behavior issues with peers. Research from an article in Neurorehabilitation indicates children with mild injuries manifested more school-related behavior problems and learning difficulties 4 months after the injury compared to 1 month after injury. This suggests that the recovery process and school reentry following a traumatic brain injury requires ongoing long-term follow-up, which debunks the myth that students only suffer short-term effects. Based on observations, student C may have injured her frontal lobes. Her frontal lobes are associated with thinking, memory, behavior, and movement. This observation debunks the myth of keeping teachers and therapists separate. The more a teacher knows about a student's condition, the more they can help that student. The article Neuroscience for Educators seems to indicate that most educators are interested in neuroscience but for personal gain, to help them maintain patience and professionalism with their students and parents, but are unsure how to integrate it into their own classroom curriculum. With learning more about traumatic brain injury, I too feel I can maintain more patience now that I understand a little more of what is going on in my students' brains. Based on a case study and the idea of neuroscience, teachers can provide different accommodations for all students, especially for those suffering from traumatic brain injury. Accommodations such as fewer problems but more frequent, visual aids for organization, more variety in student choice for lessons, cognitive tutoring with games such as Math Prodigy and No Time Test. With what I have learned so far within this program, I feel privileged to teach in a small program with only 10 students per class and around 70 altogether. This provides the much-needed one-on-one instruction that the students most desperately need, and really allows me the chance to hone my teaching skills and find new techniques to better serve my students. Much like molding clay, a student's brain can still be molded even after severe and traumatic accidents. In conclusion, traumatic brain injuries are more common than not and are often misdiagnosed, and when left untreated, patients can suffer severe long-term effects. Traumatic brain injuries have not only immediate short-term effects, but often lead to long-term occurrences that a patient must live with for their lives. Students suffering from brain-related disorders or traumatic brain injuries need teachers who are willing to learn and use new techniques in order to provide quality one-on-one instruction.